The World Health Organization calls for global digital health wallets. Are y'all ready for this? As I sit here and take in all of the news from every direction, all I see is deceivers, liars, corporate media, cover-ups, agenda, all pushing the same propaganda. It's time for a game changer, a visionary, an innovative person who changes the way that people think of the situations. It's time for Game Changer TV, telling it like it is. Get in the game. Are y'all ready for this? Thanks for tuning in to Game Changer TV. I'm your host, Terri Lynn, and this is the channel where every day we're telling it like it is. Today is June 7th, 2026, and the World Health Organization says it's time for a global digital health wallet. Let's jump into this. World Health Organization pushes digital health wallet rollout. This was from March 23rd. So a couple of months ago. World Health Organization, from their site, World Health Organization and partners launch new initiative to expand the use of digital health wallets. Why is the World Health Organization urging digital health wallet rollout? The World Health Organization is urging the rollout of digital health wallets to empower individuals with secure, portable, verifiable control of their personal health data. This digital shift aims to improve global continuity of care, eliminate forged documents, prevent fragmented medical records, and ensure seamless health tracking across international borders. When does the World Health Organization want a global digital health wallet released? The World Health Organization does not have a single universal release date for a global digital health wallet. Instead, the World Health Organization is building a global interoperable digital infrastructure through a phased approach driven by regional rollouts and international standards. Would a digital health wallet be beneficial to this Ebola epidemic? Yes, digital health wallets are highly beneficial for managing Ebola outbreaks. From yesterday, Bloomberg, Congo Ebola cases jump as CDC warns outbreak could be among largest ever. NPR, 2 days ago, CDC report Ebola outbreak could rival the worst on record unless world acts. Congo outbreak could rival the largest Ebola epidemic on record, CDC warns. Could Ebola expedite the release of a digital vaccine passport? Yes, Ebola could indirectly expedite the release of a digital vaccine passport. Is it possible, yes or no, that Ebola could expedite the release of a digital vaccine wallet? Yes, the World Health Organization and the European Union are already utilizing digital vaccine wallet infrastructure built during the COVID-19 pandemic to expand into a global public good. And who funds the World Health Organization that's wanting to expedite a global health wallet? Is Bill Gates the largest funder of the World Health Organization? Yes, the Bill and Melinda Gates Foundation is the largest contributor to the World Health Organization. So whose idea do you think this is? Follow the money? My pastor used to say 30 years ago, show me your wallet, show me your checking account ledger, and I will show you who you are. Where you spend your money shows who you are and what you're about. And the World Health Organization is out there calling for an expedited global digital wallet, health wallet. And Bill Gates is the one giving them the money to do this. Yes or no? If there's a global digital health wallet, would those without the digital health wallet be excluded from entry of locations? Yes, practically speaking. The inherent friction of non digital entry would function as a de facto exclusion. If a global health wallet is implemented for entry into locations like airports, venues, or borders, those without it would realistically be excluded. From December 5th, 10th, 2025. From AI to wearables, World Health Organization outlines global plan for digital health tools. Yes or no? Could a digital health wallet evolve into an implanted RFID chip? Yes, this evolution is already a reality. Pioneers and early adapters are utilizing biopolymer encased RFID and NFC chips, often the size of a grain of rice, implanted into their hands to act as digital wallets. Contactless payments for tap to pay credit card, medical data, stored emergency contacts, vaccination and health records, security and access, acting like a digital key for homes, gyms, and offices. Yes or no? Could an implanted RFID chip for digital currency be used with an interoperable health wallet? Yes, technically, an implanted RFID chip can be designed to share data with an interoperable digital health wallet. So now we're seeing money and health being tied together. Yes or no? Would a digital health wallet support digital currency and crypto? Yes, modern digital health wallets can natively support digital currencies and cryptocurrencies to process medical payments, manage health savings, tokens, and reward healthy behaviors. Come get your 15th booster and we'll put $5 worth of crypto on your digital wallet that's implanted in your hand. Our new health tools. You ate too much chocolate this week. We're going to deduct money out of your health wallet. Your sensors are sending back to us that your cholesterol is a little too high, too many eggs this week. We're going to have to penalize you financially for not being healthy. You didn't eat enough worms this week. We're going to go ahead and take money out of your wallet. The FDA approved implanted RFID chips. The Federal Drug Administration of the United States in 2004 has already approved implantable RFID chips for medical purposes. The FDA has authorized specific Class II implantable radio frequency transponder systems, RFID chips. The most notable clearance was VeriChip in 2004, designed for secure payment, patient information, and accessing health records, alongside later approvals for tracking embedded medical devices. A digital health wallet? A digital health wallet? The FDA approves an implantable digital health wallet? An implantable chip to access medical records? In 2004, the FDA approved an implantable chip to access health records. Where do y'all see this going? While the World Health Organization is calling for a digital health wallet that can evolve into an implant that has already been approved for health reasons. Yes or no? Theoretically, since the FDA approved implanted RFID chips for health reasons, could that include an implanted RFID digital health wallet for health monitoring? Yes, theoretically, an implanted RFID chip could include a digital health wallet. The FDA previously approved a rice-size implant, BITCHUTE, that emits an ID number linking to a secure database of medical records, emergency contacts, and drug allergies, expanding this technology to include a digital wallet for active health monitoring, vital sign tracking, or insurance information is technologically feasible. So, could a digital currency wallet merge with a digital health wallet? Yes, digital currency wallets that can evolve into implanted RFID chips and digital health wallets that are already approved by the FDA are highly likely to merge. Their underlying technologies are increasingly converging. Instead of just storing money, next generation digital wallets are rapidly evolving into secure, decentralized identity hubs that securely house digital IDs, payment methods, medical records, and health certificates on the blockchain. Yes or no? Would an implanted digital health wallet allow for the inclusion of a digital currency wallet? Yes, from a technological and interoperable standpoint, an implanted digital health wallet can include a digital currency wallet, as both utilize blockchain frameworks and near field communication to store and exchange encrypted information. Microchip implants, the wallet of tomorrow. Microchip implants, the wallet of tomorrow. And the World Health Organization is calling for digital health wallets. And the future of digital wallets is a microchip implant. What does that sound like? Bible prophecy? And he calleth all, both small and great, rich and poor, free and bond, to receive a mark in their right hand or in their foreheads, and that no man might buy or sell except he who had the mark or the name of the beast or the number of his name. Who is he going to force it on? He calls us all is inclusive. No exceptions, meaning without exception means that a rule, requirement, or statement applies completely and universally. It emphasizes that absolutely no one or no thing is excused, excluded, or giving a what? Special pass. No one is given a special pass. He calls us all to receive a mark, and no one will be given a special pass. From military.com from yesterday, June 4th, 3 days ago, the Department of Defense officially drops 180 faiths from the military's recognized religious list. Military.com has learned that the Department of Defense, for the first time in almost 10 years, has dramatically reduced the number of recognized religious faiths and belief systems by approximately 180. The reforms mark the first time the list has officially revived since a memo was issued March 27, 2017, decreasing the number of faiths from 211 to its new number of 131. The changes were iterated in May 20th, 2026 memorandum issued by the Undersecretary of War and signed by Anthony Tata, Undersecretary of Defense for Personnel and Readiness of the United States, and obtained by military.com. This latest revision to the faith codes comes at the direction of Defense Secretary Pete Hegseth to streamline the Department of War collection of religious preferences, collection of service members to enhance the delivery of targeted religious support from the chaplains. Are y'all ready for this? Senators Lee and Curtis question new Pentagon designation for Latter-day Saints. Curtis said he would ask the Pentagon for a correction after the subhead Christian was left off the designation for the Church of Latter-day Saints. Utah's 2 U.S. senators are questioning a new Pentagon policy that leaves Christian off the designation of the Church of Latter-day Saints, Jesus Christ of Latter-day Saints, which I'm not a Latter-day Saint person. I'm a Bible-believing Christian since 1978. But they're taking people's classifications off of their religious beliefs. If it's their beliefs, then your beliefs could be next. And to eliminate the classifications, to make it more simple for the chaplains to be able to minister to the people in their units, just commingling everything together. So we're down from 211 to 130, to 31. And what's going to happen when the other 31 faiths are removed? When the Christian faith is totally removed? Does this sound biblical? That the Antichrist is not going to want anybody to worship any God except for him. And it's starting in the military. In a short betrayal, Trump's DOJ files legal brief arguing employers have right to deny religiously based exemptions to vaccine mandates. DOJ files legal brief arguing employees have a right to deny employees religiously based exemption to the vaccine mandates. And he causeth all, both rich and poor, small and great, free and bond, to receive a mark in their right hand, that you will not be able to buy or sell, save he who has the mark of the beast. And he's going to call for everybody to worship him. And he's taken away definitions of what religious is from 211 down to 31. That's a big reduction. How long will it take to get down to one, that the only one you can worship is the Antichrist? And his legal department, his Department of Justice, that people say Trump is a Christian, Trump's own Department of Justice files arguing that employers have the right to deny you your religious denial of wanting to be vaccinated for religious beliefs. Why is his legal department filing a brief right now wanting to take away your religious preference of not wanting to be vaccinated? At the same time, the World Health Organization, funded by Bill Gates, is calling for a global digital health wallet that can evolve into an implantable health wallet that can merge with your digital currency and cut you off from everything if you don't worship the beast. I don't think things could be looking any more biblical. Y'all keep y'all's eyes open. Stay awake and aware and watching to what's going on around us, because prophecy is unfolding the way the prophet saw it. Scripture says this calls for the patience, endurance of the saints. I love y'all. Thank you for watching. Keep serving Jesus. If you appreciate the content that you find on this channel, would you prayerfully consider supporting the ministry?